In this video, we will discuss how diabetes is diagnosed and the chronic complications associated with it. It is very important to diagnose diabetes early and monitor frequently to prevent the damaging effects of complications. To diagnose, the doctor will likely look for acute symptoms in the medical history and physical exam. Blood glucose and A1C are two biochemical markers that can be used to diagnose diabetes. The A1C, or glycosylated hemoglobin, is one of the most important blood tests because it allows healthcare professionals to see long-term blood sugar control. The A1C is also used for monitoring, taken every 3 months to ensure the treatment plan is working. With proper diagnosis and monitoring, we can more effectively prevent the chronic complications associated with diabetes. The first chronic complication is cardiovascular disease. This is by far the most deadly of the complications. High blood sugars cause damage to the blood vessels, which leads to an inflammatory response and plaque buildup. Atherosclerosis develops early and it advances rapidly with diabetes, leading to potential for heart attacks and stroke. Cardiovascular disease is the leading cause of death in those with diabetes, affecting as many as 70%. Damage to the blood vessels also results in impaired circulation. That reduces blood flow, especially to the furthest away appendages. Nerve damage in these areas is called peripheral neuropathy and can lead to pain, tingling, and loss of feeling. Loss of feeling is particularly important because it can allow injuries to go unnoticed. Combined with poor circulation, immune factors do not easily reach the affected area to fight off infections and heal the injury. In addition, bacteria thrive in a glucose-rich environment. So the high blood sugars that accompany diabetes make it even harder to fight off bacteria that enter through a simple injury. The consequence can be serious infections. As the tissue in the affected area dies, tissue surrounding it will also die. In time, a simple injury can lead to an amputation. Those with diabetes have a 25 times greater risk of possible amputation. In addition to the large vessels of the cardiovascular system, the smaller vessels are damaged as well. This leads to problems with both the kidneys and eyes. These problems are even more pronounced when damage from high blood sugars is combined with high blood pressure. As the kidneys are affected, we see declining kidney function with increased protein excretion. Even small amounts of protein in the urine, known as microalbuminuria, can be an early indicator that the kidneys are losing function. Most people with diabetes develop some form of retinopathy. High blood sugars lead to damage in the smaller vessels of the eye. These vessels leak fluid in the retina, leading to blindness. We end with the complication affecting our teeth. This is too often left out of our discussion with diabetes. Our mouths naturally have bacteria. The plaque that develops on your teeth is full of this bacteria. As mentioned previously, bacteria thrive in a glucose-rich environment. So high blood sugars that accompany diabetes can allow bacteria to flourish, leading to periodontitis that affects the gums and bones that hold teeth in place. Those with poorly controlled diabetes have a much higher risk of severe periodontal infections that lead to possible tooth loss. Understanding these chronic complications can help with prevention. Through appropriate diagnosis, treatment, and monitoring, a person with diabetes can live a long, healthy life with minimal problems.